I think this workshop should be a dialogue. I already said in my talk that I feel like one of the important things about a meeting like this is our ability to share and dialogue with each other. So I think because we're so short on time, yesterday in the workshop I went around and had everybody introduce themselves, but I think we go till 11. So how many of you are hospice workers? Great. And nurses? Nurses not in a hospice setting. Okay, good. Social workers? Great. Yeah. PAs? Nurse practitioners? Physicians? Wow. Good. Who have I left out? Chaplains, of course, sorry. Volunteers, great. Counselors, grief counselors, great. So I want to, the purpose, what I'd like to do in this, I want to do a few exercises together, but I really want a dialogue. You've seen pretty much what I'd like to cover, which is I want to talk a little bit about what we perceive to be why it's so difficult for our culture to talk about death. I want to do an exercise on impermanence and have us debrief, and then an exercise on making a personal relationship with death, and then end with uncertainty in 45 minutes. Piece of cake, we got it. So let's talk a little bit. I'd like to hear from everybody, and if there are some things that came up in the talk, feel free to ask. But what I'd really like to hear is our experience and what do we see? Why is it so difficult for us personally and what we see in our colleagues to talk about death? And you're going to have to walk around with this because you're filming. I see. Okay.
Is that parents have a very hard time with the death of their child. And when you were speaking about having to be present, open to the impermanence of life, and that from the very beginning of life, the dying process begins. I'm sorry if I misquoted you. I don't know if that sits with me in the context of children. And I know that it certainly doesn't sit with the parents that I encounter. So I don't even know if I have a question.
Yeah, that's a great point, though, and I should have clarified that. So I would never say to a woman who's losing her partner of 50 years, well, you know, life is impermanent. That contemplation of impermanence is for us, to allow us to hold in the face of grief. You know, even though a parent losing a loved one, that's what life is. Life is loss, and life is tragedy, as much as it's brilliance. And so to me, the contemplation of loss and impermanence is a way for me to make contact with those parents and hold myself so that I don't enter into the, why did this happen to them? They're such good people. He was such a good boy. Why did he die? That's what I mean about contemplating the truth of impermanence is unfortunately, shit happens a little bit. And so the truth of birth, old age, sickness, and death is that children die. And it's for us as a way to contain it as caregivers, to be able to hold and grieve with parents, but use the way we hold ourselves in acceptance of things that happen that allows us to pull them out of the self-pity that comes up around grief. I don't know how you feel about that.
You know, what I feel about that is that I would like to know how you do that. And in the context of, you know, thinking of, the reason that I work at the hospital that I work in is because my 5-year-old died at that hospital. I was asked to, or I worked with leadership to come back, create a clinic for kids with complex medical needs. And then now I manage the pediatric palliative care program, and I'm a parent advocate. This is terrain that is really, really tricky for me, and that's a personal journey that I need to take very, very seriously, and I'm so grateful for this space that I've had for the last 4 days in order to remind me that this journey, my internal journey, it needs to, I need to precedent it. It needs to take more time in my life.
Absolutely. So, well, the very fact that you're willing to do this, the bravery of your willingness to do this, is a statement that, of course, you never accept what happened, but you can contain it. Well, you're right now containing it. You're functioning, even though inside there may be incredible turmoil and sadness and tragedy. The fact that you're able to work with families and witness it is exactly what I'm talking about. And when you ask, how do we do it? To me, I feel the ability to use mindfulness, to open yourself up completely to grief and to death. It's the power of mindfulness that allows you to feel it deeply and let it wash through you and continue to function. And cry with families. I often will tear up during family meetings. I have cried. If that's all you do, then it's hard to be an effective caregiver in that environment. But the fact that you're even saying, I think I can do this, is what I'm talking about. That inherent in that is an acceptance that people will die, children will die, and they die for reasons and for no reason, and I can be there with my presence to help contain someone's grief and sorrow. That's, to me, the acceptance of impermanence. You're contemplating the truth of your loss, and you're willing to open yourself up and be present with someone in the face of loss. That inherently is accepting it. Do you understand what I mean? If you were locked into, why me, why me, why me, which we all get into, you would not be able to function in that environment. The acceptance that, yeah, why me, and I can make a difference, and death happens. Loss happens.
That's helpful. I appreciate it.
So I want to do something. I'm actually, because I'm worried about time, I want to do a contemplation on impermanence. Now, a contemplation, a purpose of contemplation is to bring something up in your mind and let it just sit there and not think about it, but just hold it in front of you in your mind's eye and just see what arises around it. And contemplation practice also starts with posture. And the one thing I want you to leave here from this workshop, and I touched on it a little bit in my talk, is the importance of using posture during meetings with patients and families. And I can't emphasize that enough, because it all starts with posture in the same way that mindfulness practice starts. How we communicate to patients and their loved ones, our willingness to listen and be present with them, is based on what they're looking at. And we've all seen this, but I work in an intensive care unit with very busy interns, residents, fellows, other attendings, and I've seen and continue to see someone who sits down and goes, with the patient or the family there who's losing a loved one, and goes, oh my God, this is the first time I've sat down all day. Who gives a shit that it's the first time you sat down all day? And this is their posture. And then they go, so, what a terrible way to start. And I see it all the time. Or even just slouched over, or like this. I mean, I think that if there's one thing that we can talk about and walk away from this workshop, is being open and present and being in your body during an end-of-life meeting or a discussion with a patient or family communicates a lot. And it also provides you to be grounded so that when something that's incredibly tender and painful for you comes up, you can feel, and I would invite us to do that, use our feet as almost a cue to ground us. Feel the solidity of the earth under us. Whether you're wearing shoes or not, it's almost like you're firmly planted, your feet on the ground, your bottom on the seat, with a straight back, good strong back, and an open front, an open chest, an open heart. And this posture can be a valuable friend and a valuable cue in the midst of a family meeting where there's a lot of turmoil in the family or the patient, or there's a lot of turmoil in you. There's an acknowledgement that no matter what else is going on, you have your body, we have the earth, and you have your heart. That's a strong, profound starting point for listening. And what I'd like us to just contemplate, and you can do this with your eyes closed, I want you to contemplate something in your life that you've lost. Not death, but something that, if the first thing you remember when you realized that change was inevitable, when you first experienced longing that something was different, a loss. Let's just take a minute. Okay. Sorry, in the interest of time, anyone want to talk about what they remembered, experienced?
I lost Santa Claus.
Mm.
I think I was in between 4th and 6th grade. I don't remember exactly, but I had gotten a gift of a coat for Christmas, and it had a totem pole on the back of it. You know, hippie that I became, one would have thought that it would have been very meaningful to me. But I thought it was babyish. And now I was growing up. I was a grown-up. And so I lost Santa Claus. And I was really heartbroken. It was like I lost my childhood at that moment.
Thank you. Someone else?
If I was remembering more of a real painful experience. I'm a home health nurse out in the San Juan Islands, and I was seeing a little 90-year-old man and his very demented, dear little wife. This man had been being treated for back pain and had been on narcotics and had constipation. And so I was working with him on those issues. But meanwhile, his urologist, who had treated him for 20 years for prostate cancer, had said, maybe we better do a PET scan. So we had to get him transported via an ambulance to the mainland through great pain on his part. And so the PET scan was done, and he came home. And he was up in his upstairs bedroom, which was the only place he could be. He couldn't do the stairs. And I had come to visit him and to talk about his constipation and his pain and anything else that was going on. And I said, did your urologist call you with the results of the PET scan? And he said, he did, but he said, I'm going to let the radiation doctor talk to you about that. And this was a Friday, about 3 p.m., and the phone rang, and the son-in-law who was there, he had MS, and he was quite debilitated, had to walk with crutches. But he was helping the family out while the wife, the daughter of the patient, was at work. And I hear him on the phone in the next room. And the next thing he comes in and he said, Trish, would you talk to this doctor? And I said, sure. And I get on the phone and he said, are you the home health nurse? And I said, yes. He said, well, I'm Dr., I think it was Stephen Meyer. And he said, I'm the radiation oncologist and I've got the results of the PET scan. And he said, this man is lit up like a Christmas tree. We've got to get him over here for palliative radiation. He said, he's going to break bones. And I said, wow. He said, I need him here first thing Monday morning. And I'm thinking, oh, great. This is Friday. We're out on an island. This man can only be transported via an ambulance. And I said, this man doesn't know that he's full of cancer. And he said, he needs to know. And I said, then I guess I'm going to have to tell him. And he said, please. And I will tell you, I had to gain every ounce of strength I had to go back in that room and tell this man, and as he's sitting, it was also his 90th birthday that day. And his sweet little wife, they're laying on their bed holding hands. And I had to go back in and tell him, because his doctor of 20 years didn't have the courage to tell him. So I was faced with that, but then also very quickly putting a plan together to get ambulances, because this was 2 ambulances, an ambulance from his home to the ferry and another ambulance from the mainland who could take him over to have this treatment. Meanwhile, his demented wife had to have someone take care of her while he was off doing this. It was one of the most, I felt so just overwhelmed with why his doctor of 20 years could not have been honest and forthcoming enough to have given him that information. And then it all fell in my lap. And it was really tough, but I know I'm going on, but his wife, she held his hand and she said, at least we know what's wrong now. And, I left and I put everything together, but I left that day and I was so discouraged with medicine and how we don't have the courage to lovingly tell people. And his doctor, I still want to go see that urologist and tell him, you are so weak.
Thank you. Someone else?
I held on to who I thought my dad was as a person really tightly. It was sort of just his goodness and sort of his infallibility. And in adulthood came to realize that he was just as damaged and confused and vulnerable and had made a complete mess of his life. And so I lost my father without losing my father. I had to completely rebuild an entirely new relationship with him based on just moving forward and acknowledging the past, but knowing that whom I thought he was not his true self.